Long before COVID-19, the command centre has been making sense of vast amounts of data to help hospitals and healthcare systems more effectively manage their operations. This capability has now really come into its own during the pandemic and is likely to be crucial in dealing with any second wave of COVID-19 cases. This is Gardner, where the train to London departs from, and 4 hours north of London is Bradford, a city with a diverse and working class population, and also a hospital that currently has the only command centre in Europe. Mel Pickup, who I'm going to talk to remotely, is the CEO of Bradford Hospital and is going to shed some light on how they've been using advanced data visualisation and the vision for using it in the future.
Briefly give me a précis on what a command centre is.
So for me, a command centre, and indeed this command centre, enables some of our leadership team to sit in one location and to have everything at their disposal displayed in front of them that enables them to make decisions real time about what is happening with our patients, how we're deploying our resources, where our patients are, where our backlogs are, where our holdups are, where our risks are. And it doesn't need them to be running around with a bit of paper, intruding into clinical areas and intruding into the work of clinicians to find out what's happening.
What's the real-time benefit to the patient and the staff, if you like, on the ground?
So yes, reduced waiting, better experiences for patients, better utilisation of resources, most specifically the staffing resource. The fact that we avoid duplication, we avoid the need for manual procedures, we avoid the need for people constantly to have to answer the telephone to give the information that's required in order to make operational decisions on behalf of the whole organisation.
The fact that Bradford is the only one operating anything of this kind in Europe is fascinating, but why Bradford?
It's one of the most multicultural places in the UK. So we have 33% of our population that we serve come from Black, Asian and minority ethnic groups. And we know that the evidence suggests that they are at higher risk of suffering from COVID and indeed suffering quite badly the effects of COVID. But notwithstanding that, you take COVID away, that epidemiological picture in Bradford also makes those individuals 4 more times likely to suffer cancer and heart disease and diabetes. So we have a lot of people in Bradford who get sick and need hospital care. So I think there's a cultural thing that has happened in Bradford that has seen the benefit that digitalisation, use of technology, use of information can bring to the delivery of clinical care.
And I'm assuming the capability, the command centre capability, has a much wider application across the UK, across the NHS, for example.
Where we want to get to as a system is a fully integrated offer across health and social care. That would mean that the command centre benefits aren't just about what we see happening within the 4 walls of our organisation, but actually beyond, into our communities, into our primary care sector, into our nursing and residential homes, and out into domiciliary care and mental health and community providers. So the opportunity for expanding the scope, range and reach of the command centre to give us that complete view of system capacity and capability, where our sickest patients are, where our sickest members of the community or those about to become sick might be, is immense.
Mel, really appreciate the insights. Thanks.